And so I guess I know y'all are probably ready to get started. First, a little bit of background on the Affordable Care Act, often known as the ACA. It did become law in March of 2010. I know that over the past couple years, there's been a lot of news, Supreme Court cases, different votes. It is the law of the land, and there are things that are going on because of that. Some parts of the law are already in place. They already are affecting you and your family. And then other parts of the law, I think what we probably have the most questions about tonight is what's coming up. They're just beginning to take effect. You're just beginning to see them. And also in 2014, with the start of next year, to affect you and your family. So let's first talk about what does it do now. And again, I'm only talking about small parts of the law. There's no way in the time together to really get into depth in every aspect. So we're talking about what's directly affecting you. And a lot of what's directly affecting you today deals with health insurance. And most of the questions I think all of us have received already today deal with health insurance. So the key parts that are in place today. Insurance companies cannot deny a child coverage because of a pre-existing condition. So if a child had cancer or an injury or something, insurance company has to still cover their treatment. They can't say, well, we'll bring you on to our policy, but we're not going to cover anything that came as a result because of the cancer. It also allows children to stay on their parents' health insurance plans until age 26. So if you're in your family and you do currently have health insurance, you are allowed to keep your child on there until they turn 26. Plans cover preventive care at no charge to you for those visits and the tests. So when we're talking about certain tests or vaccinations for children, that's one of the things that are going on. Plans cannot limit lifetime coverage for something called essential health benefits. And bear with me because the next slide is about the essential health benefits. So I am going to explain what that means. But there are a core set of things that have to be covered, and plans can't limit how much over the course of your life that they pay for those things. You also may have received a rebate from your insurance companies. Insurance companies have to, for the premium for what you pay the insurance company to have the coverage, they have to use at least 80% of that on actual health care and quality improvement services. So if they use more than 20% or over a certain amount of the money that you are paying them for your coverage for things like administration or marketing, they actually have to give some people a rebate. So some people receive checks. I'm not sure if that happened with anyone here today. And also your coverage can't be canceled retroactively. So if something happens, they can't come back and say, oh, well, you didn't tell us about this, so we're going to cancel it. Now, there is a caveat. If there is fraud or if you're not paying your premium, your health insurance can be canceled. It's not that it can't be canceled for anything if you've deliberately lied or hid something or haven't paid your premium, but they can't come back. It's called rescission, if you've heard that word. I'm sorry. So I mentioned this thing called about essential health benefits. These are the 10 aspects, the 10 categories of things that health insurance has to cover. Ambulatory patient services. So when you have an outpatient treatment, or you go but you're not in the hospital for something, but you get a test done outpatient. That's what that means. Emergency care, you know, when you call 911 or you're rushed into the emergency room, that needs to be covered. Hospitalization. Also maternity and newborn care. So before and after, you have a child that you are cared for, and the newborn is as well. Mental health and substance abuse issues, so counseling if needed, behavioral health services, prescription drug benefits, rehabilitative and habilitative services and devices. So if someone has an injury or an accident or a disability, those services and devices to help people live a better quality of life must be covered. Lab services, when you get your blood tested and it goes off to the lab, those types of things. Preventive and wellness services. So when we talk about the things you need to do for prevention of chronic disease, such as diabetes, sugar in the blood, heart attacks and stroke, a lot of those wellness services for that. And also pediatric services, care for children, and that includes oral and vision care. So what will it do? In 2014, there are some key things that will be covered. Health plans will not be able to deny coverage or charge more because of your medical history. And this is related to everyone. Remember what I said before about children? This is taking effect for everyone, regardless of age. Plans can't limit how much your yearly coverage of essential health benefits costs, so they can't say, well, we're only going to pay this much towards these types of services. Each year, they have to cover all of it. People do have to have health insurance, and I'm going to talk about a little bit more in just a moment about that. And also, the health insurance marketplace is established.
Can you please go back to
Oh, the 10? Okay, go back and go over them again. I'll be glad to. And again, I am very, very sorry. These are the things that health insurance plans must cover. The ambulatory patient services, those are the things that you have done as an outpatient. You know, you have some treatment or test done, but you're not going completely into the hospital. You're not admitted into the hospital. Emergency services, for example, 911, or you're running into the emergency room. Hospitalization, maternity and newborn care for new moms, both when they're pregnant and after the baby's born. Mental health and substance abuse services. This does include behavioral health and some other mental health counseling. Prescription drugs. Rehabilitative and habilitative services. So if you have a disability or if you've been injured, some of those services that help you live a better quality of life. Those have to be covered. The laboratory services, when you have tests and it goes to the lab for the results. For those. Also preventative and wellness services, so chronic disease management, some of those things that, if you have diabetes or heart disease, stroke, some of those things. And also pediatric services, and that's for the kids, and that includes both dental and vision care for that. Sure. Well, I'd like to go ahead and go through this. We might have a chance for a couple of questions before our panelists start, but I really think that many of the questions may be answered as we go through, so we promise we're going to take as much time as possible for questions for that. Is that something with the Roberta, with the library? Can we make those available? Mm-hmm. Yes, if everyone wasn't able to hear that, there was a sign-up sheet if you come in, and if you have an email address, and the library would be happy to help you get one. If you don't, we will be able to share the slides, and those will be available. Yes, ma'am.
So basically, what will it not cover? You've been saying what will it, for instance, will it cover your ability to get birth control pills?
I believe birth control is covered, isn't it, Sue? Yes. Yeah, it's just been in a little bit in the news lately. Yes.
Although some of the lawyers who are morally against it, that whole issue came up. There are ways that they don't have to be forced to provide it for the right partner. Women reproductive health is covered for
Okay, thank you. So again, what will it do? And moving forward, the health plans can't deny coverage or charge more for, they have to be able to give you insurance regardless of your medical history, and that's for all ages. They can't limit the amount that yearly coverage for those essential health benefits. People do have to have health insurance, and I'm going to give a little bit more detail on that in a moment, and also the health insurance marketplace, which our panelists will be able to talk about quite a bit too. So the question comes up, what if I don't want to have insurance? One of the things that has come up a lot, you might have heard about, is the individual mandate. Yes, there is a requirement for people to have health insurance under the law. If someone can afford to buy insurance and they choose not to, they may be subject to a fee. And in this first year, it'd be $95 or 1% of your yearly income, whichever is higher, and that does go up over time. But there are exceptions. Not everybody will have to pay a fee. So, for example, if you are uninsured for less than 3 months in 2014, so in 2014, if you don't have insurance in July and August, that's only 2 months. You would not have to pay the fee for not having insurance because it was only 2 months. If you have a very low income and coverage is not affordable, and there's all sorts of formulas for that. So I really encourage you to talk to some of the health insurance specialists about that. And we'll talk about some of the navigators and the certified application counselors and some of the other folks that can talk to you specifically about your own specific situation. If your income is such that you're not required to file a tax return, you're not required to pay the fee. And there are some other limited cases. For example, if you're a member of a federally recognized Indian tribe, some religious exemptions. And also, if you feel like you can also apply for an exemption, and this would be done through the marketplace, which again, we're going to talk about a little bit more. So we keep talking about the marketplace. It's also sometimes called the exchange. In South Carolina, people will be using the federal marketplace to find and purchase insurance. And that website is www.healthcare.gov. I believe that's in some of the materials that are in the back. And there's also phone numbers that may be reached for coverage and for questions. I was told today that if you would like to talk to a person and connect with some of the different resources in your community, both represented by the groups that we have up here today and some others that will be available in the community, there will be a Find Local Help button on this webpage. If you go to it today, unfortunately, it is not there quite yet. I also want to just mention to be very alert for scams. I know Patrick and Sue and some of the others may talk about this too, but we are already seeing and hearing reports of unscrupulous people who are trying to take advantage of the confusion out there and to steal people's information and money. So, for example, people are receiving calls saying, I want to sign you up, you need to give me your information so I can sign you up for the federal health care. What's your bank account number? What's your Social Security? Please don't do that. Social Security number. So please be aware. Know who you're dealing with. Deal with people you trust. Deal with the people that you've been guided to through healthcare.gov or through your community health centers or the hospital, your doctors, those trusted entities. Know who you're sharing your personal information with. Since we're already seeing that happening, I wanted to make sure I mentioned that for that. As I mentioned before, open enrollment will be October 1st through 2013, all the way through March 31st of 2014. If you want to apply online, you will need an email address. Paper applications, so you can apply by mail, but most of those forms are available online to be downloaded. Library is a wonderful resource. I'm sure they'd be glad to help you with that. And then also with some of the in-person assistance that we're going to talk about, they'll be able to help you with that, and also over the phone. Something else that our panelists will get into a little bit more, but there are tax credits and other assistance available for some people depending on income to help pay those fees, to pay the premiums, in some cases to help pay the deductibles as well, the amount of money that you need to pay sometimes for different cases. Another question, prices for the plans are not available yet. We have not heard what those prices are. The latest I've heard, I think most of us heard on a phone call this morning, was they will be available October 1st when the marketplace opens. So I'm sure there's a lot of questions. I'm sorry I can't help you with that. I know everyone up here is sorry they can't help you with that as well. And also, before we move to our panelists for them to share their particular expertise in working with different groups in different areas of the marketplace and of health insurance and with the law, one group that is not represented up here now that can also be a resource are your insurance brokers and agents. I know some people, they work closely, they have a trusted insurance broker or agent. You do not need to leave them to be able to evaluate your opportunities. They are there, especially, we're not talking as much about some of the implications for small businesses. There's a whole other exchange for them, but some small business owners, they already have a broker or insurance agent. So definitely by no means are saying that you cannot still work with them. They are a great resource, but we're also going to be talking about other resources for those of you in the community who may not have that connection already. So I would like to start off and turn things over to the panelists. I'm sure they're going to answer many of the questions that we've already heard today and already have had written down and handed to me. We have Patrick Cobb here representing AARP South Carolina, Sue Berkowitz from Appleseed Legal Justice Center, York Glover from Eau Claire Cooperative Health Centers, and Wanda Pearson from the Cooperative Ministry. And they all have some wonderful information to share with y'all. And it may be, would you guys like the clicker, or do you want me to just move it along for y'all?
I would the clicker's fine.
Okay. There you go.
Good evening. I'm Patrick Cobb, and I'm the Communications and Social Media Director with AARP here in South Carolina. And I apologize for this voice. I probably should have gone and gotten Sammy the Barking Seal out of the children's room and brought it with me, because I've had this for 3 weeks, and this is about as good as it's gotten in 3 weeks. So I apologize for the raspiness and the occasional cough. So it's allergies and sinus. What I want to talk to you this evening about is the healthcare law and what it means for people with Medicare. I noticed in our room, it looks like we've got quite a few folks who probably are Medicare age eligible or beyond. But before we get started, in the back of the room, there was a little quiz on the back table, and several of you picked that up. It's a 10-question quiz. I have the answers, so if you want to know what the answers are, see me afterwards, and I'll share the answers with you and see how well you did on the quiz. Or I have a copy of them as well, too, you can take with you as well. All right. With Medicare, the healthcare law aims to improve Medicare by lowering the cost of the program. So in other words, the law requires Medicare to spend money wisely. And that savings is going to result in keeping Medicare financially stable for the long haul. And if you have Medicare, and listen to me very carefully, your guaranteed Medicare benefits are protected. I'm going to repeat that again. Your guaranteed Medicare benefits are protected. This includes your doctor, your hospital visits, and rehab services. And it's true whether you have the original Medicare Part A and Part B or a Medicare Advantage plan. And if you have a Medicare Advantage plan and have questions about it, most folks, as a small percentage, I did include it in the slides, but I do have information about Medicare Advantage plans and how the healthcare law affects those, so they're just not included in the slides for the sake of time this evening. One of the things with the Medicare, with the law and Medicare, you're going to receive some improved benefits. And these are going to be some great benefits that help you lower your out-of-pocket costs for prescription drugs. And we all know that the high costs of prescription drugs keep rising and rising. So right now I want to share with you a little bit of information about how prescription drugs will be affected there. How many of you have a Part D plan? Anybody have a Part D plan, a prescription drug plan, or a family member has one? You get to that point in that coverage gap that's called the donut hole, and I prefer my donuts to be a lemon-filled, the whole donut, and not the hole missing there. You fall into that donut hole after your drug costs reach $2,970 a year. And you leave the donut hole when the total out-of-pocket drug cost reach is $4,750. And when you choose to purchase a Part D plan from Medicare, from one of the approved insurance companies, you purchase that coverage, you pay your monthly premium, a deductible, and then a copay of about 25% for each drug. The coverage cap, when you fall into that donut hole, allows a little bit of financial stress for some folks there as well. Excuse me. All right, here's a great graphic of explaining a little bit about the donut hole coverage there. If you'll follow me on the left there, this is a little confusing. As a communications person, I don't do math. That's called mental abuse to humans, so I'm not good with percents and things, so just follow along with me, and we'll make this work for everybody. Starting on the left side, this is your initial benefit period when you pay your Part D deductible at about 25% of your drug cost. When you move to the middle, once you reach the initial coverage limit, you're in what is commonly called the coverage gap or donut hole. And you reach the donut hole, as I mentioned, for 2013, which is $2,970. Now, before the law was passed, you would have to pay all of your prescription drug costs while you were in the donut hole. What is new this year in 2013 is that your plan will pay 52.5% of the cost of the brand name prescriptions and 21% of generic prescription drug costs while you're in the donut hole. So it's starting to close, it's starting to shrink. And by the way, exactly how much you pay out of pocket for each drug while you're in the donut hole will vary widely depending on the Part D plan that you pick. And to add a little more confusion to the chaos here, Medicare Part D enrollment also opens in October through December the 7th. So don't be confused with Part D plans and the ACA open enrollment. They're two separate things. When you move to the right side, your total out-of-pocket cost expenses for drugs on your plan's approved drug list reaches $4,750. You reach that catastrophic benefit coverage on benefit on the right. And from then until the end of the year, you pay roughly 5% of your drug cost under the catastrophic benefit there. So what's going to happen with the donut hole? We'll take our sprinkles and move on there. Here again, it talks about if you reach the donut hole, where you get the 52.5% discount on brand names and 21% on generics. When you reach that, excuse me, I wear bifocal contacts too, so things start bouncing around on my page. The coverage gap will gradually narrow until it disappears in 2020. So by 2020, the donut hole that you just saw will close completely. However, even after the gap is gone, everyone in Part D will still have the same level of cost sharing, which is about 25%, from the time you meet your deductible until the time you reach catastrophic coverage. And then catastrophic coverage remains in place even though after the coverage gap goes away, catastrophic coverage starts when you've climbed to $4,750 at that point. And these numbers change yearly on the coverage numbers as well too there. And a good way to work if you're shopping for a Part D plan is arp.org/donut hole. There's a calculator there that you can go in and put your zip code and pull up those plans. And another great resource, if you have friends or family members or yourself looking to pick a Part D plan, the Lieutenant Governor's Office on Aging is a great place to start. And their number is 734-9900. And they have a staff of SHIP counselors who basically help folks walk through Part D plans. And it's a free service provided by the state and the Lieutenant Governor's Office on Aging. So we talked about what's in it for Medicare, and these are some of the things that you're going to see: more preventative care services, and I think South Carolina will greatly benefit from some of these screenings. You'll no longer have to pay for a Medicare-approved preventive care services. You'll also be able to work with your doctor on a personalized prevention plan to keep you healthy as possible. And that means that health problems that can be detected sooner and can be treated a little bit quicker. Just a few examples of the Medicare preventive benefits that are now covered: a yearly wellness visit, screenings for diabetes and cancer, and also no co-payments, which means no co-payments or deductibles. It also includes mammographies and colonoscopies as well too. And the Secretary of HHS may add other tests and screenings just depending on what may happen with the law and how things roll there. And these preventative services are also in addition to, when you turn 65 and become eligible for Medicare, you also have a Welcome to Medicare checkup that's available to every person that's a part of Medicare, so you can get a good good health history with your physician. You can always call Medicare at 800-633-4227, and then Medicare.gov as well as another point of entry for you to talk with Medicare folks there. All right. Like most people with Medicare, you want to make sure that you get quality health care, and you want to know that primary health care is available for you. And the law addresses some of these needs. Primary care doctors who treat people with Medicare will now receive a 10% bonus payment. This will also help ensure that you continue to get the medical care you need. In other areas with doctor shortages, Medicare will give extra payments to physicians and nurses who provide primary care, and will also encourage nurses to serve underserved communities. People who receive Medicare home health services in the original Medicare must have a face-to-face visit from a healthcare practitioner or physician to certify that you're eligible for Medicare-covered home health services. The healthcare practitioner can be a physician, nurse practitioner, clinical nurse specialist, certified nurse midwife, or physician's assistant. And the face-to-face visit must occur within 90 days before you receive home health care, or 30 days after you start. This doesn't apply to people who have a Medicare Advantage plan. As I mentioned, if you have a Medicare Advantage plan, I'll be glad to talk with you after we're finished here. One of the things that we've all heard about is Medicare, the waste, fraud, and abuse in Medicare, and that's one of the things that the law also goes to clamp down on, to cut inefficiencies in care, reducing the waste to help drive health care costs down, and it also will help strengthen Medicare's long-term stability. According to official estimates, the cost savings of some which come from reducing waste is to keep Medicare financially stable for more than a decade longer that if no law had been passed. So, I mean, it's really looking down to help cramp down on some of the information there, protecting your personal information, and then there's the Medicare number as well again there. Just a quick little summary here is that the ACA law helps lower prescription drug costs, protects guaranteed Medicare benefits, improves Medicare covered benefits, and does make a few changes to Medicare Advantage plans, and reduces waste, fraud, and inefficiencies, which is a big thing when it comes there. One of the best things that we have going for us right now is our healthlawanswers.org website, where you can actually go in and select South Carolina, what state that your family member or someone can live in, and you can actually shop for health care, health insurance there with our Health Law tool there. So it's a great thing. If you'll notice on the right side of the screen, there's a drop down under the FAQs and glossary. There are fact sheets, tools, and all kinds of things that you can print there. But this is a very easy to use tool. It's also available in Spanish, so it's a great opportunity there that we have on our website. And then these numbers, we'll go through these, we've gone through them, but it actually has the websites, the links, the phone numbers there. It doesn't have the SHIP number. Again, the number for the SHIP counselors in South Carolina is 803-734-9900. And with that, I think my time is probably up.
Very good, Patrick.
To be a Southerner, I speak very fast. I'm sorry.
Before we move forward, I do want to let everyone know I was able to talk to Roberta, and all the slides will be posted on the library's website. They have a page devoted to information about the Affordable Care Act, and they will be posted up there.
I'm Sue Berkowitz, and I'm with South Carolina Appleseed Legal Justice Center. And I want to apologize. Patrick's with AARP, but I'm going to do old school tonight. I'm not going to give you any slides because I'm actually going to give you the two websites, one that's that's up and running right now, and one, God willing, we're going to have up and running by October 1st, and which I think will help folks in South Carolina understand the debate, understand the issues with the Affordable Care Act. And I just want to say I come to this with I love the Affordable Care Act. I have spent my life working with people who have not had access to health care and insurance, who have found themselves in bankruptcy, have found themselves not able to always get the care they need, things that I'm blessed and have always been able to access because I have health insurance. But I'm going to tell you a personal reason why I really love the Affordable Care Act. About 15, 16 years ago, my organization had health insurance, but we were losing it. We were losing it because we were losing all of our federal funds, and we were having to scramble to figure out how we're going to keep ourselves open. And at that time, I had a 2.5-year-old son and a 5-year-old son, and my husband was self-employed. So he didn't have health insurance coverage himself. We got it through my place of employment. Like most people in the United States right now who have health insurance, we got ours through my employer, but we lost it. Now, I can tell you as a mom, there was nothing scarier than knowing I had 2 small children. I wasn't worried about myself. I'd get by. But I had 2 small children without health insurance, especially my baby, my 2.5-year-old, who had been born with a congenital heart defect. Not life-threatening, but he had been born with it. And we tried getting health insurance. And first we went up tried to get health insurance for an individual plan. And you know what? They didn't want to insure my 2.5-year-old. Can you imagine a 2-year-old being uninsurable? Well, I had one. Now, thank goodness my law degree came in handy because I was a member of the South Carolina Bar. So I got to go into a group health plan. And I got him health insurance that we were willing to pay for out of our own pocket and get both of our children insured. And let me tell you, I'm going to say something I never thought would come out of my mouth, but that strapping 20-year-old right now, he's in the Navy, and he's on the best socialized medicine out there. He's on TRICARE, and he's serving our country. So that's why I love the Affordable Care Act, because I don't ever want to have to tell someone that, no, I'm sorry, you're uninsurable. No, you can't get insurance. No, you had the audacity to get sick, so it's going to be 4, 5, 7 times more than it would cost someone who was healthy. And that's what the Affordable Care Act is going to do for folks. I know, Megan, you're probably having conniptions right now, but you know me, you asked me, I can't help myself. Now, the first thing you need to remember about the Affordable Care Act is if you have health insurance and you like it, keep it. No one is going to take your insurance away from you. I'm still going to get my health insurance through my employer. Now, we're going to get new insurance because our insurance company has decided to drop all of our providers, but we're going to have health insurance and we're going to keep it. And everybody I work for gets to keep their health insurance. So if you have something and you like it, don't let anybody scare you into thinking you can't keep it. Who does the Affordable Care Act help? It helps the over 750,000 people in the great state of South Carolina who are uninsured right now, who aren't as lucky as myself and my family and my wonderful son to have health insurance and have that health insurance card so they can go to the doctor and they can get coverage when they need it. But what happens now when you go to the marketplace if you can't afford health insurance? Well, first of all, we don't know exactly what the plans are going to look like, what their costs are going to be. But we know that it's going to be a group plan, that it's going to have to offer all the wonderful things that Megan told us all about, including some free coverage like preventative care so we all can make sure we're healthy every year and get our checkups and make sure we're not getting sick, to cover the prescriptions that we need so that if we do have something that needs coverage, we can make sure that we're getting the care that we need. But if you can't afford health insurance and you go into the marketplace, the wonderful thing about the Affordable Care Act is it's going to provide health care subsidies and tax credits. And it's going to be based on income. Now, the reason I don't want to have percentages and poverty rates all up there is it makes my eyes glaze over, and I live for this stuff. But I can tell you for people who are under 100% of poverty, who makes a little over $12,000 a year, when they go into the marketplace, They'll be told what that insurance costs, but they'll also be told they get a subsidy to help them pay for it. And depending on the insurance that they buy, and depending on what the market, what we know the health insurance plans look like, that insurance for somebody who really has no money to reach into their pocket for anything could be as low as $1 or $2 a month. Now, it's not going to be the insurance that may give them all the health care they need when they go to the doctor. They may still have co-insurance and co-pays, but they will be able to get health care insurance. So if that horrible, terrible things happens, if they have a real health catastrophe, they'll have health care to cover them. And let me tell you, if we want to know why people file bankruptcy, Harvard Law did a study on that a couple of years ago, and we know that 50% of all bankruptcies are due to not being able to pay your health care bills. And that is going to be peace of mind for a lot of folks. So it's going to be really important for people to go into the marketplace, but to also educate themselves before they go into the marketplace, to understand what it means if 80% is going to be covered or 20% is going to be covered, or if it's a gold plan or a silver plan or a bronze plan, what the subsidy might be. And a lot of that is very, very confusing. Now, healthcare.gov is a wonderful, wonderful website, and I love that website. But I want to tell you, there's a young lady sitting over there, Katie Blaylock, who's been working with our office. She got a small grant, and we're going to be putting up something just for South Carolina called signupsc.org. Now, it's not how you sign up for health insurance, but we hope to make it simple and understanding. And it is my hope that signupsc.org, and we'll make sure the library has that on their website, will have links to things like healthcare.org, to have telephone numbers of people in South Carolina that are acting as navigators, as the folks are going to be talking here, to make sure you remember when somebody knocks on your door with a clipboard and says they're coming around from the Obama administration, they're signing you up for Obamacare, you know that's not how you sign up for the Affordable Care Act, and you can go someplace that you can trust. So we want to make sure that you make good decisions, that you go through the navigators. And I'm going to give you another website we're going to have up on the Richland County site for you called SouthCarolinaHealthCareVoices.org. This is a site that South Carolina Appleseed has been maintaining with our partners AARP and with the South Carolina Small Business Chamber of Commerce, where we have probably more information than you would ever want to know about the Affordable Care Act. It has the good, the bad, and the ugly, but it has good information. We're not going to try to scare you. We're not going to try to make you afraid to educate yourselves and sign up for health care and sign up for health insurance. It's to let you know how you can educate yourself. And we want to make sure that you go to those two sites as well as healthcare.org. You work with the navigators, and you also work with the healthcare centers and the certified application counselors. Now, I do want to tell you one thing that I'm not happy about right now in South Carolina. Now, Megan's really hiding her head. Is there are going to be people,
5 to 7 minutes.
There are going to be people who aren't going to get coverage. And they're not going to get coverage because South Carolina will not expand Medicaid. Medicaid expansion was an important part of the Affordable Care Act. It was to help people about 138% of poverty or below, meaning someone who makes about $15,600 a year and below, get health insurance who weren't eligible for Medicaid right now. Because despite things that I think people hear and we hear from some bad information from, no offense to my media friends, from the media, is being poor doesn't get you Medicaid. You have to be eligible for other reasons. And there are over 293,000 people in South Carolina who would be eligible for Medicaid expansion who aren't going to get it, and these are all adults. And by not expanding Medicaid, probably more than 200,000 people are going to fall through the cracks. Now, there will be services at the South Carolina federally qualified health care centers, and they can be your medical home. There will be free health care clinics, but those aren't medical homes, but they're a good start.
People shouldn't look at emergency rooms for their primary health care. They need to find a medical home. But we should be expanding Medicaid in South Carolina. And we, along with AARP and a number of our partners out there, are going to continue to fight for that, because it is a shame when we're going to be making health care available for millions of people, the poorest of the poor are going to be left behind. So I look forward to answering questions and having discussions with you. It is complicated, but there's a lot of good information out there, and I know that because you're here, you're going to be educating yourselves to make sure that you pick the right medical plan for yourself and go into the Affordable Care Act with an open mind to make sure you get health care coverage for yourselves. But there's a whole lot of people who aren't here, so we need to get the word out. We need to let people know, because if it's not us who tell people, it's not going to come from the state of South Carolina. And if we're silent, all those uninsured are going to stay uninsured. So thank you.
Thank you, Sue. I'd like to bring it on to York Glover with one of our local health centers here in Richland County, and definitely a great resource for those who may have trouble finding insurance. As Sue said, there will be a gap between some people who may not be able to find some. The health centers are an excellent resource, which is why we've asked them to be here. Would you like the clicker, or I can hit for you? Or
If you can, that'll
okay.
be great. Can y'all hear me?
Got it? Okay.
I will talk slow. And I just want to make sure I'm clear when y'all are listening, so you can hear me. A lot of people are afraid, and a lot of people are very concerned when it came to affordable care. A lot of people call it Obamacare, and a lot of people are saying that this president is trying to change how health care is represented in the United States. Well, I wanted to make sure we understood that over the last 100 years, there have been several presidents, not because it was a presidential agenda, it's the need of the people, that the executive office said, okay, there's something that needs to be done. At that point in time, America needed something to be done. Now, some things pass and some things fail, because that's the democracy that we live in. But the fact of the matter remains that as a country, we saw the need and we wanted to implement change. So what's happening now, the same concerns and the same frustrations were the same frustrations that happened when Medicaid and Medicare got passed in 1965. There was some concerns with our Medicaid Part D. There's a question mark on President Clinton because, CHIP got passed, but there were other things that he wanted to pass, and it just didn't happen the way he lined it up. But please understand, if there's something that's moving when it comes to healthcare, it's because there's a need. It may not affect you per se, and I think for some of the folks in here, it is affecting you. But if it's affecting just you, please understand it's affecting hundreds and hundreds of thousands of people in South Carolina and millions of people throughout the United States. Next slide. Next slide. Now, back to affordable care, how to apply. They're trying to make it as simple as possible, okay? And I'm going to explain this as simply as I possibly can, and as we have the questions and answers, we can get into some more details. But you can apply online, you can apply by phone through a toll-free number, you can apply by mail through a physical paper application, and you can apply in person. There are several organizations, Eau Claire Cooperative, the Cooperative Ministry, the Benefit Bank, and other organizations that are working throughout the not just Columbia, but its surrounding counties to try to introduce, educate, and enroll as many people as we possibly can. So whether it be online, whether it be by the phone, whether it be by mail, or whether it be one-on-one conversations that you can have with people, we're trying very hard to make sure we get everyone enrolled, those who want to have coverage. And if you don't have coverage, you would want to have coverage, and we'll talk about that later. My Vanna, my assistant.
So I was making a quick check about timing.
Okay, Sue touched on the percentages. I'm not going to really stay on this. There are 4 different plans: the bronze, silver, gold, and platinum plan. It shows on average what is going to be covered for you, and then also on average what you're going to be responsible for. Now, not putting this up there to scare you, but if you've ever had a plan, my wife just went back to work, God bless her, and well, God bless her, because she's a teacher in high school. But when she went to fill out her benefits, she had options. Now, each option had a different cost, and each option also had different coverage based on the cost that you were paying. It's nothing different than what we're showing up here. So we had to look at, as a family, based on the options that you're receiving from your employer, what's going to be the best thing for the 2 of us and our 3 children? And how can we make sure that our family is going to be covered in the best way possible? But as Sue alluded to earlier, a lot of people don't have the time or the option to make those decisions. What's going to be the best coverage for me and my family at this time to make sure we have some coverage so we can be okay? This is just giving you that option. So as opposed to saying, well, we're just going to fly by the seat of our pants and hopefully no one gets sick, hopefully no one has an accident, hopefully there's nothing that happens that we can't control. I don't know who controls your life like that. I don't know that. But it just makes sense to make sure that you have something in place so that if something does happen, you're going to be okay. Next slide. Okay, last slide. And I want to explain this and make sure we understand, because this can get confusing. The enrollment period is October 1st through 2013 through March 31st, 2014. Now, if you enroll before December 15th, 2013, your coverage takes effect January 1, 2014. If you enroll a day later, December 16th, then your coverage takes effect a month later. So it'll be February 1st, 2014. And this is like any other coverage that happens when you enroll in coverage. Now, between the 1st and 15th of January through March, the first day of the following month is when your coverage takes place. So if I apply for coverage on March 15th, April 1st, my coverage takes effect. If I apply March 16th, then it's May 1st. Does that make sense? Okay, now, and that's at last, between the 16th and the last day of the month, between December and March, it'll be the next month. All right, so if you enroll on October 1st, I say hooray. But don't go to the doctor and think that you're going to have coverage before January 1st. All right?
Very important point to make. Thank you.
Please make sure we understand that. All right? And if you enroll on December 16th, that one day, February 1st. Okay? All right. I wanted to keep it short and brief. Yes. Oh, yes. As all things. In all things, your enrollment process will not be complete until the first premium payment has been received. This is affordable health care. It's not free health care. It is affordable. And, there's some calculators that give you a pretty good guesstimation of things, of what's going to cover. And I looked at some of the things that's on the system, and I looked at what I've paid in the past, and I'm like, wow, seriously? Where was this 3 years ago? Because it's actually for my family and my income and my family size, there's certain programs that are actually less than the group plan I was paying for at my previous job. So get the information and make the decisions based on you and your family's needs. because nobody knows your needs better than you. Make sense? All right. Thank you.
All right, thank you. Thank you. And I want to apologize for falling down on the job for the slides there. I was checking with the library. I know this forum was advertised to be ending at 8, and I'm sure some of you are looking at your watches worrying that I'm not going to be able to answer my question. Pending our panelists' availability, I was told that we can stay here until 8:45. Is that correct? Till 8:45. So as long as our panelists are willing and able, we were going to do our best to get through all of y'all's questions. But before we open up the question period, let's go on and give Wanda a chance to share her knowledge and go for it.
I'm Wanda Pearson with the Cooperative Ministry, and I have only one slide. And I really just wanted to take advantage of this opportunity to tell you about our federal grant, which is to provide the navigation services. We are here to assist you with your health insurance questions. We are here to assist you right up to the point of enrollment, if that is what you desire. I would like to introduce the partners in the project. Up front here we have Tim Leszewski, thank you. Yes, from the South Carolina Progressive Network. Henry and Deanna, I saw y'all come in, so I know you're in the room. Okay, Deanna Bookert from the Greater Columbia Community Relations Council. Linda Dowson, who is the area coordinator for the Cooperative Ministries part of the project. And the activities that we are conducting are enrollment, education, and outreach assistance. Our areas of focus, primary areas of focus, are Richland, Lexington, well, all the counties are here, I won't read them to you, but keep in mind that we are here to assist anyone in the state of South Carolina who needs assistance. We will have an 800 number coming soon. In the meantime, this is our email address for questions specific to the navigator portion of our mission at the Cooperative Ministry. We envision having locations throughout our service areas, including our partners' offices here in Columbia. And we will be making services available evenings and weekends. So to augment the information that you may get online, when you get to the point where you want to talk to someone face-to-face, that's where we come in. And I encourage you to call us for any type of assistance that you need to access the marketplace and decide what plans are going to be best for yourself and your family. And also, if you have ideas as to locations that you think might benefit from having a navigator present on a regular schedule for a few hours each week, please share that with us as well, because we are in the process of developing our schedule. We want to make sure that our services are accessible to everyone, no matter where they happen to be in the state.
All right, thank you.